49% of physicians report being burnt out, but which specialties have the greatest rates of burnout? Dr. Jubal, MedSchoolInsiders.com. After 3 years of steady increase, physician burnout and depression declined for the first time since 2020. However, there's still a long way to go to get those numbers down. Depression amongst physicians is back to where it was in 2021, but burnout is still at a whopping 49%, which is 8% higher than the 2020 report from before the pandemic. Unfortunately, even though many COVID-19 stressors have let up, they have been replaced with others, including understaffed hospitals, reduced funding, and stagnant salaries. So, which specialty has it the worst? At number 1, with 63% of practicing physicians reporting burnout, is emergency medicine. EM doctors treat patients with urgent healthcare needs, from acute conditions like heart attacks to exacerbations of chronic health conditions to stabilizing patients involved in trauma. They tend to be jack-of-all-trades doctors because they are faced with so many different health concerns, emergencies, and surprise circumstances. There are many reasons why so many EM doctors report burnout. EM doctors work on the front line, which means consistent high intensity, stress, and unpredictability. It's also an unfortunate reality that a large number of patients abuse the emergency department. Homeless patients may fake a medical condition, also known as malingering, so that they can have a guaranteed meal and a roof over their head for the night. It's also common for uninsured or undocumented patients to use the ED not for emergencies, but as their source of primary care. People who are addicted to narcotics often visit the emergency room in the hope of finding painkillers, something that's become increasingly common due to the opioid epidemic. Dealing with intoxicated or agitated patients means EM doctors face a higher risk of physical harm from their patients than physicians in other specialties. EM doctors also face higher risk of litigation due to the higher rates of malpractice claims compared to the average physician. Naturally, these situations are not necessarily the fault of the patients, but it's something many EM doctors, depending on where they practice, often deal with on a daily basis. And aside from moments of excitement and high stress, the most common things EM doctors treat are headaches, abdominal pain, and chest pain. The treatments in these cases aren't always definitive, and the standard workup can grow repetitive and tedious. For these reasons and more, EM doctors face a high degree of burnout. And the number 2 spot is OB-GYN, which covers both obstetrics and gynecology. Obstetrics is the medical and surgical management of pregnancy, and gynecology is the medical and surgical management of the female reproductive tract. OB-GYN doctors see patients through puberty, adult life, pregnancy, menopause, and beyond. The lifestyle of OB-GYN physicians is on the more challenging side, as it's common for them to be on call for a range of gynecological or OB emergencies. It's a very unpredictable and active specialty. When these physicians aren't running between labor and delivery, the office, and the emergency department, they're standing in the operating room. Plus, while delivering babies is rewarding, it's also very stressful and messy. It's a specialty with a high degree of blood loss, and the blood is often combined with other bodily fluids and solids during labor. On top of the unpredictability, the mess, and the stress, OB-GYN physicians also earn lower salaries than doctors in other specialties, averaging $308,000 per year. For context, on average, physicians make $352,000 a year. Some specialties make over $500,000 a year, including plastic surgery, orthopedics, cardiology, urology, and gastroenterology. And the number 3 spot is oncology, which focuses on the diagnosis and treatment of cancers, as well as complications that can arise from cancer and its treatment. 53% of oncologists self-report burnout from their job. You likely don't have to think too long and hard to figure out why this specialty suffers from burnout. Oncologists are faced with cancer on a daily basis, which means they're also faced with death and delivering potentially devastating news to patients and their families. Additionally, the little work-life balance oncologists have continues to lessen as they become more and more bogged down with increasing administrative burdens. These rising demands on oncologists mean they are less productive at work and therefore have less time away from work. Oncologists face many organizational limitations of healthcare. This is especially true of the private sector, which unfortunately often cares more about the bottom line than what's best for patients. It can be discouraging for oncologists to not have the adequate time to spend with patients or the necessary resources to help them. Telling someone they can't afford the life-saving treatment options available or that there simply aren't enough resources to help them is very challenging, to say the least. This emotional burden takes a toll on oncology physicians and builds over time, leading to higher rates of burnout. And the number 4 spot is pediatrics. Pediatricians care for babies, children, and adolescents from birth up to the age of 25. Because they are dealing with children, they also deal with their patients' parents. This presents 2 different patient types and relationships to maintain, which can be quite a lot to balance. The life of a pediatrician is not for those who lack patience and empathy, as young people are sensitive and require a soft touch. Their tempers and nerves are often completely frayed, so pediatricians must remain calm, empathetic, and consistent at all times, which can grow very difficult over time. On the flip side, not all parents are good parents. Pediatricians see a number of children who have been abused by their caregivers, which is never easy. And then there's the elephant in the room. Losing patients is always tough for a physician, but it can be especially difficult to lose children. Understandably, it's not easy for a pediatrician to leave work after losing a child they've developed a relationship with and have dinner with their family like nothing happened. It's hard not to take that kind of devastation home. There's also not as much research within pediatrics compared to adult medicine. This can be extremely frustrating since certain drugs have not yet been tested on kids for efficacy and safety protocols. As with other primary care specialties, pediatricians have to spend a great deal of time on the computer and charting. Considering many of these physicians went into this specialty to work with kids, having to spend so much time away from them can also be grating. To top it all off, pediatricians' compensation is one of the lowest of all medical specialties, averaging around $250,000 a year. This is partly due to the payer mix. Many children are on Medicaid, which has lower reimbursement than commercial insurance. US healthcare has a fee-for-service model, and children generally require fewer interventions than adults, so adult specialties often earn more money. At number 5, with 51% of physicians reporting burnout, is family medicine. Family medicine is the center of primary care. These physicians treat the broadest range of ailments and patients, from newborns to seniors and everything in between. They are not limited to a single organ, disease, or age range, so to be effective at their job, they need to be familiar with and stay up to date with many different areas of medicine. Retaining and maintaining this knowledge is quite a bit of work that's often not accounted for in their daily duties. Plus, family medicine physicians consistently earn one of the lowest doctor salaries of any specialty at just over $250,000. While that's a decent paycheck, family medicine doctors still have a similar burden of debt to doctors in different fields, and their reduced salary means they are not able to pay off their debt as soon as other doctors. There's also a great deal of computer work and charting involved in family medicine. Their day-to-day is increasingly concerned with documentation and billing, which determines the compensation or reimbursement they receive from insurance companies. Depending on their patient population, many family medicine physicians also need to juggle a number of different social issues with patients, such as insurance coverage, access to care, and more. Family medicine doctors may have better work-life balance than some specialties in terms of total hours worked or predictability of those hours, but when they're at work, they're moving fast through patients and are compensated towards the bottom of all specialties. The next 5 in order of burnout are radiology with 51% burnout, and pulmonary medicine, anesthesiology, gastroenterology, and internal medicine all tied at 50%. Many of the specialties with the highest rates of burnout are those in primary care, which is the first line of defense in healthcare. For these physicians, the amount of charting and other clerical work continues to increase at a rate much higher than procedural specialties, thanks to electronic medical records. While EMRs are required for effective billing, it forces physicians to work longer hours and spend less time face-to-face with patients and more time facing computer screens. Additionally, it's becoming more common for smaller practices to be bought up by private equity firms. The goal of these firms is to make as much money as possible, so they have a short-term investor return mindset rather than long-term goals in mind. They aim to reduce costs while increasing output in order to turn the practice around and sell it again at a profit. This process puts a greater workload on physicians and other hospital workers and adds stress to an already incredibly demanding job. These long hours, coupled with tedious charting responsibilities and stressful work environments, have pushed many physicians to quit medicine. I covered those reasons in more detail over on the Kevin Jubal MD channel. Check out the Doctors Quitting Medicine Reaction playlist. If you're still struggling to choose your medical specialty, check out our So You Want to Be playlist, which takes a deep dive into the pros, cons, and training steps for every medical specialty.